I can't believe this is meant to be her big gotcha, Madam Deputy Speaker. But I say to her, if she wants to ask me the questions and have me answer them, call a general election, I'll happily oblige.
It's an opposition debate. I am responding to the Labour motion with an amendment.
Now, this little exchange between Victoria Atkins and Wes Streeting is at an Opposition Day debate on NHS dentistry on the 9th of January, where our Health Secretary believes she's got our Shadow Health Secretary in a bit of a gotcha. But has she?
And so the picture in Wales, if it is indeed the blueprint that the the leader of the opposition paints it as being, that picture in Wales is not perhaps as convincing as the Labour front bench would have us believe. And the fundamental difference between the system that is in existence at the moment in England and that of Labour is that Welsh Labour has a list system for dentistry, sometimes called a capitated system. And I note he didn't explain in his speech whether he intends to adopt that scheme. And I'm very willing to give way to him now for him to clarify whether that is the system he wants to bring in.
I can't believe this is meant to be her big gotcha, Madam Deputy Speaker. She can't even tell us when she's bringing forward her plan, let alone what's in it, and they've had 14 years to come up with one. This is absolutely astonishing. As much as I enjoy these kind of partisan knockabouts across the dispatch box, I think the sight of the Health Secretary giggling and laughing at her own jokes will be of small comfort to people who are literally pulling their own teeth out.
Sorry, OK, so just to cut through all the froth, the honourable gentleman has not, in fact, answered my invitation. Does he wish to have a capitated list system as they have in Wales, or does he have other plans? Please, could he answer it?
Well, like any responsible government would, we will consult with the dentistry profession, with the BDA, and come up with a serious programme for dentistry reform. But I say to her, if she wants to ask me the questions and have me answer them, call a general election, I'll happily oblige.
So again, cutting through the froth, the honourable gentleman has called this debate. He has not set out his plan. And he knows full well, it's an opposition debate. It's an opposition debate. I am responding to the Labour motion with an amendment. He has no plan on dentistry. And when I asked him to clarify whether he is following the capitated system in Wales, he has declined to answer. And I assume that is because he knows that we have tested a prototype system based on a capitation approach here in England. And the results from that, this is the system that we see in Wales, the results from that prototype system were clear. It worsened access and it widened oral health inequalities.
Now, the capitation system, from what I managed to find out, is a payment system where lump sum payments are made to care providers based on the number of patients in a target population to provide some or all of their care needs. The capitation payment is not linked to how much care is provided. Capitation is used to determine core funding for UK general practice. However, most sustainability and transformation plans in England also aim to move towards an outcome-based capitated budget. Now, the pros are, as a capitated payment is not linked to how much care is provided, providers have the flexibility to spend money on services they think will secure the best outcome for the patient. The potential for more integrated care and evidence that professionals work more closely together when working under a capitated budget. Evaluations of programmes elsewhere show that they are more cost-effective than other payment systems. Cons are, though, providers are paid regardless of what they deliver, enabling them to provide as little care as possible to minimise costs. Well, you'd think the Tories would be up for all that then, wouldn't you? They do not necessarily take into account changes in levels of demand. As has been seen in general practice, services delivered by different organisations require significant capabilities on the provider's side. For example, coordination between primary and secondary care and sophisticated IT to to track individual patients' activities. Now, I don't know whether it's the zinger Victoria Atkins thinks it is, but I do have my doubts, especially when I heard a few of these stories from MPs about those within their constituents.
And let me give you an example of one of my constituents who's been trying for over a year to register with an NHS dentist. He's now had to go private for the consultation, which says your teeth are in very poor condition, most of your remaining teeth decayed and unsavable, all of your teeth except for 2 need extracting. He's been living for over a year on painkillers and soup. I've raised it with the Minister. I've got no satisfaction. This is what Tory Britain is doing to dentistry.
After being told of the importance of seeing a dentist after suffering multiple miscarriages, my constituency tells me she's been struggling for 3 years to see a dentist within a 50-mile radius of her home. Dentists said they're going private and only helping with emergencies. Surely this is evidence of a colossal failure of Tory government dental policy, and even the most vulnerable are suffering.
Their own constituencies whose teeth are rotting, and their conclusion is, what's the rush? What's the rush? Well, let me tell them why they should get their skates on. A 17-year-old boy in Plymouth had to undergo emergency surgery on an abscess in his mouth last year. He spent 2 months trying to book an NHS dentist. He says he was on hold for about 3 hours a day. According to figures on the NHS website, there are no dentists taking on new NHS patients in the Plymouth Moorview constituency. It was left too late, and when he finally got the healthcare he needed, emergency surgery was required, which has left him scarred for life.
Not really the zinger you think it is it, Victoria Atkins? If you think that's a fantastic gotcha after 14 years of Tory rule and gruel, it's quite sad really, isn't it? But what do you guys think? Let me know down below. Have a lovely weekend and take care, my friends.